I am Dr. Arvind Gupta. I am Senior Consultant and Head, Department of Diabetes, Obesity and Metabolic Disorders at Mahavir Jaipuria Rajasthan Hospital, Jaipur. Dear friends, whenever the patient comes of the type 2 diabetes for the first time to us, what is our moral duty? Of course, glycemic control is the first and foremost thing in our mind, but we have to think right at this moment to prevent the atherosclerotic cardiovascular disease in these type 2 diabetes patients, whether asymptomatic, whether they have event or not, whether they have family history or not. Type 2 diabetes mellitus is an equivalent to a coronary artery disease risk. Hence, it is better to start the anti-atherosclerotic therapies right at the onset of diabetes mellitus. What we know about ticking hypothesis of the cardiovascular risk, that even before the onset of type 2 diabetes, atherosclerosis starts way before. Hence, we cannot wait till an myocardial infarction or angina or any cardiovascular event comes to prevent this cardiovascular disease in the type 2 diabetes patients. How to modify these cardiovascular risk? Of course, the lifestyle modification is the first and foremost thing. Apart from the lifestyle modification, we have to advise our patients to stop smoking. Exercise to the tune of around 150 minutes per week is recommended by all the European and our Indian guidelines also. Not only this physical activity, but we have to reduce the stress by means of yoga and other meditations to have the best lifestyle modification. Of course, diet is also very important. As far as Indian things are concerned, we have to reduce the carbohydrates, we have to increase the proteins, and of course, fats to be around 1/3 of the saturated fatty acids, 1/3 of the monounsaturated fatty acids, and 1/3 of the polyunsaturated fats, and keep the cooking methods in such a way that we should use as minimum as possible the fats. Of course, fats are integral part of our diet, and around 15 to 20% of the fats, the calories should come from the fats. Apart from the lifestyle modification, which sets the goal of reducing the cardiovascular disease, we should have the good glycemic control, and we have known that if you reduce the HbA1c of the patients even to the target of less than 6.5, or in some patients it is less than 7%, we can think of reducing major acute cardiovascular events. We can think of even reducing the stroke and the other macrovascular complications. Apart from glycemic control, then we have to think of reducing the blood pressure. The hypertension control in type 2 diabetes patients is the very important thing to achieve or reduce the cardiovascular disease risk in the patients. And to achieve the antihypertensive goal, we have the several drugs, but still the ACE inhibitors and ARBs are the drug of choice, apart from diuretics and calcium channel blockers and beta blockers also to come at the rescue or to reduce the hypertensive burden in these patients. Apart from these, we can think of even primary prevention in the form of antiplatelet drugs, or the platelet inhibiting drugs are very important, whether it is aspirin, clopidogrel, or even dual antiplatelet drugs to reduce the cardiovascular burden in our type 2 diabetes patients. Then comes the dyslipidemia, which is again very important, and we know that reducing LDL cholesterol can reduce the cardiovascular burden, can reduce the cardiovascular events in type 2 diabetes patients. So, dear friends, we should have a holistic approach whenever we think of reducing the atherosclerotic cardiovascular disease or even cardiovascular disease risk in type 2 diabetes patients. So, for that diabetes lifestyle risk factors, the lifestyle intervention, systolic blood pressure or blood pressure control, lipids control and of course glycemic control are the main goals to achieve or reduce the cardiovascular disease factor risk in type 2 diabetes patients. Think of always these approaches, multifactorial approaches to reduce cardiovascular disease burden in type 2 diabetes patients. Thank you very much.